What is up, y'all? It's your girl Kayla, and we are back with yet another video. Y'all already know, before we get into this video, I gotta let you know thank you and welcome for joining, y'all. Thank you so much for tuning in and welcome. If you are new here or if you're returning, welcome. I appreciate every single one of y'all who tune into these videos and share, comments, give feedback, like, you name it, anybody, or if you just watch it. I appreciate that so much. So I'm not even gonna hold y'all. We're just gonna get straight into this. As y'all can see from the title, I have a couple of things that we want to talk about today. And if you are one of my, more, I don't want to say more seasoned, because even that still just kind of like, it says that you're old, but you're not old. But if you're more versed with insurance and life insurance, health and life insurance and guardianships and things like that, then hopefully you can give some feedback in the comments, add any additional advice or tips or anything. That would definitely be greatly appreciated for myself and other people. But I'm going to let y'all know what I'm doing right now, how I'm preparing, how I was preparing before I got this new job, and everything else that you might want to consider when you're looking for health insurance or life insurance as a single mom by choice, aka an SMBC. So, as y'all may know, if you were like OGs, last year I was laid off from my job because of COVID. We lost way too many patients, basically. Yeah, they were patients. We didn't lose them to death or anything. It was just the shutdown. People weren't coming to their appointments because they're at risk, and we lost so much business that there was a major downsizing. And that's basically it. There's a major downsizing, but a couple things I knew I needed to do: keep money coming in some way, somehow, to keep a roof over my head, and also ensure that when I do have this baby, because I am still trying, that we would be covered with health insurance and life insurance. We would still have the essentials that we need, because this pandemic, regardless of the fear mongering and everything else going on that convinces people that this is just going to be the way of life forever now, is going to come to an end. So that was my thinking. And since then, I was able to look up insurance programs for people, or insurance for people who are not receiving insurance through their employer. So I went on the Cover California site, and I know I did not want to do Medi-Cal or Medicare, because even though it is free or reduced, you're able to get emergency medical insurance when you're pregnant. I already know, and y'all seen this video already, about the higher maternal mortality rate for women of color. Women in general in America, which is so freaking ridiculous. Well, duh, it's going to be women, but people in general in America, our maternal mortality rate should be going down, not going higher. You should be able to go to the hospital to give birth and know that your rights are going to be respected. You are going to be cared for. People are going to take their jobs seriously and not put you or your baby's lives at risk, and not cut corners just because they don't feel like dealing with you, or they want your labor to hurry up and be over. So I'm not going to get back on that soapbox. If you want to see more statistics and details, I will be sure to link those videos down below. But yeah, I know that when you go into a hospital, just as a girl of color, I have had people automatically disregard what I'm saying and believe that I'm false. So much so that I had a nurse practitioner, this old man at the hospital near me, go on almost a 40-minute rant about how I was so easy and fast in the pants And that was my issue and my generation's issue. And that's why, I needed to have some sort of birth control inserted in me, since I just refused to close my legs. And all the while, I'm just going to get my prescription refilled because I have endometriosis. And I was going on a missionary trip in a couple of weeks to Africa, and I didn't want to run out of medication and have to deal with my endometriosis symptoms while I was there. But please tell me again how my issue was that I'm just so loose. So, yeah, and then when I told him what it was for, when he finally shut up, he also did not believe me and had his own choice words until finally I told him to just look in my chart. And he saw the clinical diagnosis for endometriosis. That is not new, that I'd literally had since I was 18. So that is something that I do not deal with. I do not put up with when it does come my way. And I'll be darned, I do not want to have to deal with that when I am trying to give birth. So the people that'll be with me are people that I know are great advocates, and I'm doing my best to get the midwife that I need to ensure that we're safe. And if my midwife cannot deliver, she also does Montrese services, so she can come to the hospital with me. So that's what I'm looking at. And because of that, and I know that risk, I'm also making sure that my OBGYN remains the same. So my OBGYN, she's a black OB. Didn't get her because she was black. I actually got her because she had a 4.8 out of 5-star rating. And that's a lot when you have a lot of ratings on there and on multiple sites. That's why I got her. And because she knows that the mortality rate is so high, I knew that I would be in better hands with her. And originally I found her because she specializes in endometriosis and infertility. And I needed somebody who was educated on this because I refuse to spend another appointment arguing my diagnosis with somebody when I've already been diagnosed and my body has proven that the treatment works. So, anyways, that's that. But that's also why I'm researching my insurance, because depending on what you have, you can't go everywhere with every kind of insurance. And I've had patients that were calling me saying, well, I have great insurance. I have Medi-Cal. Unfortunately, I hate to say it, Medi-Cal is probably the worst insurance that you can get because you're so limited on where you can go, and they limit what procedures you can get and when you can get them. They want to make sure that it is absolutely medically necessary. And even then, depending on some of these procedures and things, if there are other cheaper alternatives, they're going to want you to do those instead, and they may not even cover those. Like, I used to work at a place that provided transcranial magnetic stimulation treatment, aka TMS, for people with chronic depression. And Medi-Cal flat out will not cover it. They have said it repeatedly. They have it written. They don't cover it. So I don't want to have to run into those issues if I get free insurance. I don't want to, or discounted insurance through Medi-Cal. And also, because I'm a person of color, I'm already discredited when I walk into the hospital. Unfortunately, it's something that happens way too often. So much so that I've been going to the same doctors for years after researching them for a long time because I refuse to go through that crap again if I can help it. So, and every time I have to go to an urgent care or somewhere where I'm not on my usual staff, guess what? Conversations like the one that nurse practitioner gave me happen. So I knew that going in, when it's time for me to give birth or anything, I don't want to have to deal with anybody discrediting me because of my insurance, because they're going to see it. And they're going to associate all the negative stereotypes they have about people with government insurance with me. And when I'm fighting for my life and trying to give birth, I don't want any kind of doctor or nurse or anybody else looking at my health insurance and knocking my life down. Just, not knocking it down, but just treating me like my life is worth less because I have government insurance. And I'm not saying that this is okay by any means. I'm not saying this is okay. I'm saying that's wrong on so many levels, and we should not do that to people. We should not. I get it. Government insurance does not pay as much as private insurance does. Everybody has different rates that are contracted out, and they pay less. They make providers jump through 1,000,001 hoops more than they would for private insurance, just so they can accept that insurance. I get it. But that doesn't mean the patient should have to suffer. So that's why instead of me just saying, okay, I'll do Medi-Cal when I turn 26 because I'll be pregnant and blah, 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 instead of me saying that, I said, you know what? I need to get insurance that I'm familiar with, A, and B, I know that I'm going to be able to get the providers that I already have because I spent way too much time researching them and getting, building rapport with them to just lose it because I'm changing my insurance because I'm 26 now. So right now, my insurance, I've been writing it out. I'm under my mom, thankfully. So it's given me plenty of time to research the insurance plans my job gives me specifically, which is different depending on any company you work for. So I'm not going to tell you what my premium is. I'm not going to tell you what my out-of-pocket is or anything like that, because everybody is going to be different, and I don't want you feeling some kind of way if my numbers are lower than yours or my numbers are higher. Whatever, you come in with one expectation and it's different from yours. So I'm not going to tell you, who we have. I just know our options are Cigna and Anthem. Obviously, there's a crap ton of other insurance providers, but those are the ones my company provides, and then they do cover half the cost for whatever they're contracted with. So right now, my hardest decision is, do I want an HMO or do I want a PPO? Right now, even though I have a PPO, I've grown up with a PPO, because the HMO is significantly cheaper and the out-of-pocket max/deductibles are also significantly less. I am leaning towards going towards that, but what I needed to decide before I made that, or what I needed to know before I made that decision was, hey, is this insurance going to be accepted by my current primary physician and my OBGYN? And because it's an HMO, you have to get referrals before you go anywhere. So will my primary care physician be able to refer me to my OBGYN? Because I don't want to lose her. Thankfully, both of my doctors accept this HMO. They accept, like I said, they accept this HMO. And now the only thing I have to do is just double check with my doctor, which I doubt is going to be an issue, but I want to make sure I'm dotting my I's and crossing my T's. I just want to make sure with him that when I do make this switch, he will be able to give me the referral to my doctor, because I don't want to lose anything. And thankfully, they are in the same network, yes, but they're also in the same hospital group. So Sharp Reese Steele is a huge network of hospitals here in San Diego. And I'm sure there are other private hospitals as well, other hospitals. But I know Sharp is the huge network here, unlike where I originally hail from, where there's several different hospitals and they're not associated with each other. So because my doctors are in that network, I I can talk to my primary and let him know who my OBGYN, even though he already knows, and just make sure he is able to refer me to her when I switch to an HMO. And if he is not able to, which is why I want to double check before everything is going down, if he's not able to, I will just go ahead and switch up my paperwork so I can accept the PPO option, which is going to be more expensive, but I get everything that I'm used to and I get everything that I want, and I don't have to have any kind of stress or worry about it. I don't save as much money, but that's fine. I can make up that money somewhere else. So that's what I'm doing with health insurance. I highly recommend you look on the Covered California website and see what plans are available for you depending on your tax bracket and your needs. It'll give you a lot of wonderful information. Definitely recommend that. And if I remember, which I'm pretty sure I will put the Covered California website link in my description box so you can check that out yourself. If y'all already have your own insurance, you are not new to the gang. If there's anything else that you can think of, please put it down in the comment box down below. Anything that I missed, please put it down below, because I feel like when it comes to insurance, you can't have enough information, and this would definitely be helpful for not just myself, but anybody else who watches these videos. Y'all can see, I think y'all can see how many people watch these videos. So obviously somebody is going to see it and they will be able to be blessed by your comment and your advice. So please do that. And then next portion is life insurance and guardianship. So like I said, I'm what you would consider an SMBC. That's a single mom by choice. I do not have a partner. Yes, I wish I had a partner with this, but I don't. And with that, that means it's all on me. So if something does happen to me, it's all on me, and I got to make sure my babies are okay. So I'm going to do everything that I can while I'm on the side, land of the living this side, to make sure they're okay. And by doing that, that means I'm getting life insurance and I'm determining guardianship if anything happens to me. So my life insurance plans, I have seen offers for, I think the lowest I've seen is 15,000. I've seen another for 25, 50, and 100,000. And I'm sure it can go above that depending on what all you have. Shoot, maybe even 200,000, who knows? But I just have to think about realistically, what bills do I have? What things do I have that don't go with me when I die? So my student loans, I used to freak out about that. And then I found out when I die, doesn't nobody else have to pay for my student loans. So I can die in peace now. But no, I think about my car loan, and that's really it that I have left. Like, I worked so hard to get rid of my debts before I started trying to conceive. So that's really it. Everything else can be written off. They just got to see a copy of my death certificate and we're good to go. But when it comes to my kiddo, and this is more specifically for here and now, if something happens to me when I'm giving birth, I need to make sure that there's enough money to cover my hospital bills, the baby's hospital bills. I need to make sure there's enough money to cover funeral expenses, cover, whatever's left on the loan of my car. That way my family, whoever is going to be taking care of my kids, will have a family car that's in great working condition, still new, to drive them around in, and just things like that, So I'm getting everything organized and keeping a lockbox with all my information in it and whatnot. So if anything happens to me, they can go to that, get it, and know, okay, this is her insurance plan. This is, everything. My will, you name it, and make sure everything is there. One second. All right, so just making sure everything is there. I'm not gonna say how much my life insurance is, but I do recommend that you get enough money in life insurance to at least cover medical expenses for you and your baby. Any loans or any debts that you may have that don't necessarily go away when you die, but they might try to place it on next of kin, and research what can be waived when you die so you don't have to worry about any of that. And then also living expenses, because now somebody else is going to be raising your kids because you're not here and they did not sign up to give birth to a baby, So some extra money to help that kid, help them pay for that kid growing up, and even, some money so if they go to college or whatever, they can have something from you. So money is not the answer to everything, no, but it will make things a lot easier financially, easing that burden when you do die. So I'm looking at that. I do have one, two, I have two or three life insurance policies, and I have them split up. So right now I have three people chosen to, step in case something happens, and it's just in order by who's available, or, who is first, basically. So if anything happens to one, there's the other one. If anything happens to one and two, there's the third, and I know, even though I don't have number 4 set up on there, obviously if something happens to all three, like some freak accident, number 4 already knows to step up and will be able to take care of my kids. But right now, those 3 are on my insurances, and it's set up to where if anything happens to any of them, it automatically kicks over to the next person. And I'm just doing my best to make sure everything is organized and ready to go and all that great stuff. So, yeah, I'm not saying who all I have just because I don't need certain people to hit them up and be like, hey, so I know you got that money. We all know at least one person in our family or in our life that does not have any kind of moral bone in their body and will show up and be like, hey, so-and-so died. I know you got her kid. Where'd the money at? We don't need that. Those kind of people aren't allowed around my kids anyways. So there's that. I know it's very, very vague because I can't give specific numbers. I'll tell you this. Based off of just what my mom recommends, because she also was raising the 4 of us by herself, because all of her siblings were across the country in the South. Well, not across the country, but, they're in the South. She was the only one in her family in California raising us 4 because, that's where she was born and adopted. And shout out to Big Mama, may she rest in peace. Thank you for adopting her and giving our family just an amazing life. But also my uncles. But I will say that she did have to do a lot of preparing, and it wasn't easy. She had to basically live in survival mode. And because of that, she has been so much help when it comes to me doing this and me embarking, knowing ahead of time, thankfully, that I'm going to be a single mom, and helping me. So what she recommended to me, $50,000 is good. $50,000 is good. It'll cover your funeral. It'll cover medical expenses. Great. But $100,000, if you don't have a house, is great, because now it'll cover your funeral, any kind of medical expenses you have, any loan that you have, like my car. Um, and it'll leave some money over to help whoever is raising my kid and help make up that financial difference. So, if I have to recommend any number to anyone, I would definitely say try to get a plan for at least 50,000. And if you don't own a home, and depending on how many loans you have and whatnot, try to see if you can find another amount for 100,000. Something. And obviously, the more you have, the better. Blah blah blah. Because then no matter what happens, that your kids are going to be fiscally, financially covered and taken care of. So that's my plan with that. That is my recommendation to you. There are so many life insurance policies and groups that you can find. So if you are employed, I highly recommend you speaking to your HR person and asking them what kind of plans are available to you or who your company uses for employees to get their list. And it may be a long list, but more times than not, it's going to be a short list of companies that they work with. And also just do your research. Ask your family members. Ask your friends who they recommend. Maybe not necessarily how much, because I know people get very uncomfortable when you ask them certain prices because, again, there are those people that do not have best intentions. So unfortunately, people tend to be more tight-lipped about how much their life insurance policies are and whatnot. But ask them, hey, who do you recommend? Because I really want to get life insurance. I want to make sure that if anything happens to me, my kids are taken care of. And they'll be able to let you know if they do have life insurance, hey, I like so-and-so and I like so-and-so, or I like so-and-so because X, Y, and Z. Or I don't have any, but I know somebody who does and they like them for this XYZ. And talk to several people and see who they recommend so you can do your research not only from word of mouth, which is always great, but also look them up on the Better Business Bureau, look them up on their Yelp, anything where they are reviewed. Definitely Better Business Bureau to see how they truly treat their customers. See what kind of plans they have, see what reputation they have, and make that informed decision yourself. I highly recommend it, and I get it. This whole conversation was a bit heavy because it's a lot, and nobody wants to think about death, especially when you're trying to bring forth life. But for me, I was not able to fully breathe until I got my life insurance plans and everything in order, because it has been something that worried me so much, knowing the maternal mortality rate and just being human, period. It was very concerning for me. So I really wanted to come on here and just share this information with you. If you have anything else that you would like to add, any recommendations or any other advice, please put it in the comment box down below. Also, if there's a video that you want to see, a question that you have, or a topic that you're interested in, please put it in the comment box down below as well. Don't forget to like this video if you enjoyed it. Comment, as I said, because I really love y'all's comments. And then subscribe. Hit that subscribe button and that notification bell. I will see y'all later this week.